Everyone, so this is the ATTR 362 early ticket assignment, and this video is pertaining to interferential stimulation, and I will be using IFC for short during this. So interferential stimulation is the fifth most frequently used physical agent, and the IFC is a symmetrical sinusoidal medium frequency alternating current. The IFC consists of two channels that have different frequencies, but they act at the same time, and the two currents cause tissue current amplitude modulation. So the basic principle of the IFC is to decrease resistance, so the stimulation is not painful. So when using bone stimulation, the bone stimulation uses a medium frequency, which causes less resistance by the skin, while being able to generate a more comfortable current. So when using the IFC, there are 4 electrodes, and they are placed in a square on your patient, and the electricity moves from the two channels, and they will cross in the middle, and when it crosses, this is called a vector. So the advantages of the vector pattern are surface area and deep stimulation, and the tissue is better targeted. There's an easily localized treatment. The treatment for larger areas is better accommodated, and the treatment of poorly defined pain. So the effects of IFC are pain relief, reduction of muscle spasms, the stimulation of motor nerves at higher amplitudes, and the advantages include a large area coverage for the TENS unit and the stimulation of deeper tissues. And the IFC is more comfortable because the medium frequency currents meet with less skin resistance. The disadvantages of the IFC is that it eliminates pain, but it does not get rid of the cause, and it merely masks the more serious problems, and so that's why it can become just a cure-all. So, and there are very few portable units available for use, so this can become a problem in clinical use. So the indications of IFC are acute pain, chronic pain, muscle spasm, and pain that covers a large area. The contraindications associated with IFC are not to use it if a person has a pacemaker, a history of heart disease, and you need to discontinue the use of IFC if skin irritation occurs. The precautions for IFC include an impaired sensation, skin lesions, and you need to use caution when using IFC when the patient may be operating heavy machinery. And so to prepare for using IFC, you need to prepare the equipment first. So you need to make sure that the output is on a minimal setting, and you need to prepare the electrodes by attaching the electrodes, which are the pads that will be placed on the patient's skin. So you need to attach those pads to the cords, and then you need to attach the cords to the actual TENS unit machine. And then you will apply them by using a conducting medium, and you need to explain, sorry, I lost my place. You need to explain the procedure to the patient by stating that what type of sensation they will be feeling and what currents you're using. And you need to also make it known that electrocution is not possible and that there should be no surface pain. So show the patient what you're doing. So perform it on yourself or show what you will be doing. Don't necessarily perform it on yourself if you don't have the electrode pads on. And you need to make sure that the electrodes are going to stick to their skin. So if they're not going to stick, you need to use tape or wrap. So in order to use the modality, first you need to turn it on, and then tell the patient you're beginning, and slowly increase the intensity to the patient's comfort. They should start to feel pins and needles, but it should feel comfortable, and there should be no muscular contractions. So it should also be adjusted for specific injuries. So acute pain should have about 80 to 20 with immediate pain relief lasting a few minutes to an hour. For chronic pain, you should use a low impulse rate of 1 to 5, which could take a half an hour, but it may last 6 to 7 hours. So you need to use target or vector buttons for easily identifiable pain areas and dynamic vectors for pain that's hard to pinpoint. So the length of the application should be approximately 20 to 30 minutes, and it can be applied once or twice a day as needed for pain. And you can continue using IFC until it no longer has an effect. So once the patient is no longer feeling an effect, you need to discontinue using IFC. So in order to stop using IFC, the application, you need to turn the power off and return all of the controls to off or at least to the minimum setting. And you need to remove the electrodes from their skin and clean them. And you are going to place the electrodes and belts in their proper place and instruct the patient to schedule their next treatment, and be sure to tell them to limit their activity. So return the generator to the cart and then put the cart back in its proper place. And then you need to check the fuse in the back of the unit to be sure that it will not turn back on. So I talked about washing the electrode pads or cleaning them, and you need to clean them with warm water and a mild detergent, but do not wash them. I should say don't not clean them, but don't wash them if they're self-adhering electrodes. And also be sure that the wire is firmly attached to the electrode post. And then you need to, after you clean the electrodes, you need to make sure that there's no way when you store them that they're going to be able to become unclean. So that is all I have for the interferential stimulation mini lecture for ATTR 362, and I hope you guys find this to be informational. So thank you for watching and have a great day.